Welcome to today's Explainer. I am absolutely thrilled you're tuning in because, well, we're tackling a topic that is just incredibly important, but honestly, really misunderstood. Now, I know that the second we hear the word cancer, our immediate reaction is to stress out. Walls go up. But I want you to take a deep breath right now because this is not some scary doom and gloom medical lecture. Not at all. Instead, I want you to think of this as an empowering, super straightforward, and highly actionable guide to women's health. We're taking the latest medical insights, stripping away the jargon, and breaking it all down so you can actually understand your body better and take proactive control of your own health journey.
To kick things off, I want to anchor our entire explainer right here with a direct quote from our medical source. It says, "If found early, over 90% of patients can expect a cure. Please rest assured." I really wanted to establish this optimistic tone right from the jump. Because, look, this isn't about fear, right? It's about awareness. When we know exactly what to look for, the odds are overwhelmingly in our favor. So, do me a favor and just keep this 90% figure tucked in the back of your mind as we go through today's info.
Okay, here's our quick roadmap for today. 1. The 2 uterine cancers. 2. Causes and risk factors. 3. Unmissable early symptoms. 4. Tests and diagnosis. And 5. Diving into that 90% cure rate. Let's get right into it.
Section 1. The 2 uterine cancers and spotting the difference.
Okay, let's dive into this, because the public confuses these two all the time, but they are entirely different beasts. So on one side, you've got cervical cancer. This happens at the entrance of the uterus. It typically hits a younger demographic, and it's triggered by completely different causes. But on the flip side, we have endometrial cancer, which you might also hear called uterine body cancer. This one develops in the inner depths, specifically in the lining of the uterus. It's primarily driven by hormones, and unlike cervical cancer, its onset really peaks when women are in their 50s and 60s. We really have to draw a firm line in the sand between these two because they require totally different types of awareness, totally different tests, and different treatments. So for today, our focus is strictly on endometrial cancer.
Moving right along to Section 2. Causes and high-risk factors.
Get this, an overwhelming 80% majority of endometrial cancer cases are actually caused by long-term exposure to estrogen, literally 4 out of 5 cases. That means the inner lining of the uterus is just being stimulated by this female hormone for a really extended period of time. Only the remaining 20% of cases stem from unrelated causes. So honestly, understanding this estrogen connection, that is the master key to understanding everything else about this disease.
And what's really fascinating here is how the biology actually works. When those estrogen levels stay high and they just continually stimulate the uterus, it can lead to a condition called endometrial hyperplasia. Basically, this is a precursor condition where the uterine lining just grows way too thick. It's kind of like giving a lawn way too much fertilizer, right? It just overgrows. Now, not everyone with this condition will develop cancer, but it is the stepping stone. And once you understand that simple biological pathway, that high estrogen leads to a thickened lining, it completely removes the fear of the unknown. It's just biology, and biology is something we can monitor.
So building on that estrogen connection, let's methodically walk through this checklist of risk factors. And hey, please don't panic if you see yourself on this list. This is purely to help you self-identify so you can be proactive. High-risk factors include nulliparity, which is a medical term meaning a woman has never given birth, as well as polycystic ovary syndrome, or PCOS. Both of those relate to ovulation issues that mess with hormone balance. Other factors include long-term use of female hormone medications, underlying conditions like diabetes, obesity, and hypertension, taking certain breast cancer treatments, or just having a family history of uterine or colon cancer. If a few of these apply to you, it just means you need to be a little bit more vigilant. That's all.
All right, Section 3. Unmissable early symptoms.
Listen, if you take away literally one single thing from this entire explainer, please let it be this: abnormal bleeding. This is the single most common, absolutely crucial early symptom. We need to completely normalize talking about this, ladies. Abnormal bleeding is not something you hide. It's not something to be embarrassed about. It is literally your body's built-in flashing red alarm system waving its arms and telling you to go get a checkup.
Now, while abnormal bleeding is definitely the star of the show here, there are some supporting symptoms we need to watch out for. We're talking abnormal vaginal discharge, lower abdominal pain, which, by the way, often tags along with the bleeding, pain during sex, and lower back pain. But I really need to stress that top bullet point, post-menopausal bleeding. Because remember how we said endometrial cancer peaks in an older demographic? Well, that means any bleeding that happens after menopause, or even just really unusual bleeding during perimenopause, absolutely demands immediate medical attention. Look, it might turn out to be nothing at all, but you just cannot ignore it.
And this brilliantly illustrates how your age totally flips the script on what that bleeding actually means. If you're in your 20s or 30s and you experience abnormal bleeding, your statistical risk of endometrial cancer is actually super low. It's way more likely to be just a simple hormone imbalance or maybe something related to cervical cancer. But as we move down the chart to women in their 30s and 40s, prolonged bleeding means you should definitely be tested for both types, just to be safe. And then, once you hit your 40s, and especially zooming into your 50s and 60s, that risk profile for endometrial cancer significantly spikes. So yeah, age dramatically shifts how we interpret this symptom.
Okay, Section 4. Life-saving tests and diagnoses.
So, say you go to the doctor with some of these symptoms. What actually happens? Well, here is the exact diagnostic journey you can expect. First up, they'll likely do a quick ultrasound to measure the thickness of that uterine lining we talked about earlier. Second is a tissue biopsy, where they take a tiny sample from inside the uterus. Now, I want to be totally real with you here. Our medical sources do note that this specific step can be mildly painful. But honestly, knowing exactly what's coming makes the whole thing far less intimidating, right? From there, if they need more info, they might do some blood tests for tumor markers and finally CT or MRI scans just to get the complete picture. Step by step, it's a very clear, highly effective process.
Okay, stop right here, because before we celebrate these diagnostic tools, I have a very, very critical warning for you. General health checkups usually only test for cervical cancer. I'm going to say that one more time so it sinks in. Your standard, routine gynecological exam, it is almost always just a cervical smear. Women cannot rely on standard checkups to catch endometrial cancer. It's just not going to happen. If you have the symptoms we just discussed, you absolutely must actively advocate for yourself and explicitly request an endometrial screening from your doctor. Do not assume you're cleared for everything just because you had your routine checkup.
Finally, Section 5, 90% curable with early detection.
So the crucial point is this massive, incredibly reassuring number right here. 90%. Endometrial cancer is not a difficult disease to cure if you catch it in time. If the disease is found early and it's still confined to the uterus, over 90% of patients are totally cured. Literally all the information we've gone through today, understanding the estrogen connection, recognizing your risk factors, spotting the abnormal bleeding, and knowing to ask your doctor for the exact right test, it all leads to making sure you land safely in this 90% bracket.
So I want to leave you with this provocative question. Will you listen to your body's alarm system and prioritize your life-saving checkup today? You have the knowledge now. You know the difference between the two cancers, you know exactly what symptoms to look for, and you know how to advocate for the correct tests at the doctor's office. You are educated, you are empowered, and you are entirely capable of taking proactive control of your health. Thank you so much for joining me for this explainer today. Stay healthy, stay vigilant, and please always listen to what your body is telling you.